So Ebola is making a lot of headlines. There's a lot of controversy about it. Some of it myth, some of it fact, fiction. To sort it all out for us here, we have Dr. Rex Archer, a medical doctor, and also director of the Kansas City Health Department here to kind of clear it all up for us. So I guess we can start with this whole push now, this new movement to quarantine medical workers who've been in West Africa actually treating Ebola patients. What's your thought on that?
Well, I think that's overreaction. Folks that have gone over to help stop the outbreak in West Africa need to be honored and respected for that activity. They went over to try to stop an outbreak. They're not going to come back here and spread a disease either. So, yes, we need to monitor them. They need to be checking their temperatures twice a day. But they're going to notify us, as the doctor did, that he had some concerns, and we've isolated him now.
So, you know, over the weekend there was a nurse who returned to the United States who'd been treating Ebola patients. She was quarantined. Now she's been released, but she was really angry and was actually calling and talking with TV reporters on air because she was angry she'd been quarantined.
Well, we've learned in public health outbreaks and epidemics over the last 200 or 300 years that when you overdo the quarantine, that's not helpful. That drives people to distrust. They're more likely to try to hide or not be open with you. So public health works best. We had a measles outbreak this summer. We had over 60 folks here in Kansas City that had measles or could have been exposed to measles to spread it to other folks. So we did what we call a voluntary quarantine. We provided them with opportunities for food and various things, but we didn't put police in front of their door.
So you understand that so many people are really operating out of fear, you know, that this could spread from one person who comes back from West Africa, infects unknowingly, infects others. I mean, there is some fear out there, and that's real.
Well, the fear is real, but fear that makes us either over or underreact isn't healthy. And for an outbreak to occur, on average, you have to have one person expose and infect at least one more person for it to be spreading. And that's not happening in this country. We've had the two healthcare workers who were in a situation with very high levels of exposure. That's the other thing that's, I think, a little confusing for the public, is that some diseases like measles can be spread airborne, and they can be spread several days before people even know they're ill. Those we do a voluntary quarantine for. But for folks like with Ebola, even when you start having symptoms, you're not having a lot of virus that's being shed, and nobody's catching the disease in those early stages.
So you're not contagious until you actually begin to show symptoms?
Not only that, but you're really not very contagious until you're extremely sick.
So let's try to calm the fears. Tell us let's get the basics again. How can you get Ebola?
You get it from direct contact with somebody that has Ebola. And since there's almost none of those in this country, people, first of all, can just take one breath and kind of relax a little bit. You know, there aren't very many cases here.
So we're talking about being in contact with their blood, saliva, bodily fluids.
Correct. And even there, it's not until that more end stage, when they're actually bleeding and having a high virus count, that they're very contagious. So it's the direct healthcare worker that's exposed that is at risk. And of the 3 folks that have gotten it in either Europe or the U.S., they were all healthcare workers that were treating patients that were extremely sick. Not just regular Ebola, but at the end stage where people were actually dying, and that's when you have the highest virus count.
All right, Dr. Rex Archer, who is a medical doctor and director of the Kansas City Health Department. Thanks so much for coming in at the drop of a hat and sharing this good information with us.
Yes. Well, thank you.